Okay, what kind of radiology is 7 series? Diagnostic radiology. There are two types of radiologies, diagnostic and interventional radiologies. So interventional radiology falling under entire series of codes from 1 to 9 series, except 8. So diagnostic radiology alone will be falling under 7 series. So you'll come to know the difference later. What is the difference between diagnostic and therapeutic intervention radiology? 8 series, path
Pathology.
and
Lab.
lab. 9 series would be
Medicine.
medicine and part of E&M.
EN.
So total nine codes we have from 0 to like 10 codes, 0 to 9. So all this range of codes has been categorized into 6 sections total. Remember carefully. 6 sections. What are they? First sections would be anesthesia. Second section would be surgery from 1 to 6 series. The codes which are falling under 1 to 6 series, some part of 7 series, some part of 9 series. Consider as a surgery. 2 series, we do not have 2 to 6, like 1 to 6 and 7, 9. Then after surgery, diagnostic radiology. Diagnostic radiology. After that, path and lab. Then medicine section. Then evaluation and management. That is called E&M. So how many sections total as per this?
Sections.
6. So this is the categorization of CPT book. Entire CPT codes have been categorized into 6 sections. These are the 6 sections. So anesthesia falling under 0 series, surgery will falling under 1 to 6, some part of 7 and some part of 9. Diagnostic radiology 7 series, path and lab 8 series, medicine and E&M both are different sections falling under 9 series. Understood? Did you get the idea?
Yes.
Okay. Now we'll move to the surgery. What is meant by surgery? How will you define a word surgery? So we can say surgery is one of the 6 sections, right?
Yes.
So how can you define a surgery? Anyone can speak.
It's a branch
It
of
is based on the
medicine.
global days.
Sorry?
It is like a treatment.
Based on the
injuries.
global days, we can code surgery.
Okay. What is meant by global days? How can you define a word global days?
Minor surgery belongs to 0 to 10 days and major surgeries belongs to 0 to 90 days.
Yes. What is the days? Global surgical days. Okay. GSP period. Global surgical period. So based on which criteria you will define this particular procedures will be having 0 to 10 days. This procedure will be having 0 to 9 days. How will you define? Okay, I'm saying you laceration or IND. What is the global period for that? Incision and drainage or laceration repair, very small procedures. So as you said, 0 to 10 days. So these 0 to 10 days, how will you define? Based on which criteria?
If the patient goes on the same day, procedure done and going on the same day, it may belongs to 0 to 10.
Based on the healing time, they will decide this global surgical period. So anyhow, GSP topic will be discussing later. First, we'll go step by step. Okay. So surgery definition. While coming to surgery definition, surgery is a section of CPT or medical section of CPT, or I can say type of medical specialty. So who will perform surgery?
Surgeon.
So physician or surgeon. So where a physician, if there is a major surgeries like heart transplantations or kidney transplantations, so those kind of surgery required more than one physician, right? Group of physicians were required to perform such kind of procedures. Agree everyone with this word?
Yes.
Yes.
So here I mentioned because of that, where a physician or group of physicians perform what they perform. What kind of surgery? There are different types of procedures, right, in CPT book. It may be diagnostic or
Therapeutic.
therapeutic or sometimes screening services.
Screening also.
So surgery is a type of medical specialty where a physician or group of physicians perform either diagnostic or therapeutic or screening service. Where it will be performed?
In hospital.
Every
room.
procedure will be performed in hospital.
Operating room.
Operating room. So operating room is a part of hospital. So
Yeah.
certain minor procedures will be done in clinics also, right? Physician offices. Bedside procedures. So either in physician office or
Or clinical laboratories.
clinical laboratories or hospitals. So with or without help of surgical equipments. Certain procedures may require surgical equipments like curette and knife, this and all, and scope is this and all. Certain procedures, they do not require any surgical equipments, with or without help of surgical equipments. So does it make sense, this words about surgery definition?
Yeah,
Surgery is
sir.
a type of medical specialty where a physician or group of physicians perform diagnostic, either diagnostic or therapeutic or screening services, either in physician office or hospitals with or without help of surgical equipments. So does it make sense, guys?
Yeah, yes, sir.
Okay, fine. Now we should know. So, okay, a procedure has been done by physician. We are coding. And sometimes we need to append the modifiers, right? What is meant by modifier? While coding surgery, modifier is very important. I'm giving the definition to understand the concept of modifier. So later in further classes, we go to the different types of modifiers we'll be using in surgery from 22 to 82. So how?
And modifier is nothing but it give addition information.
Yes. So modifier is a 2-digit code, first of all, right? 2-digit code, which may be alpha or numeric or alphanumeric. Can you give any example for alpha modifiers? The two numbers, like 2 digits will be alpha only. Any example? Modifier.
Yeah, you mentioned.
T1, T2, E1, E2.
Yes. Either alpha or numeric or alphanumeric. So first we'll go to alpha modifiers. What are the alpha modifiers, guys? T1, T2 will be falling under alphanumeric.
TC,
Mix modifiers.
like anesthesia.
Yeah, TC modifier, TT modifier.
RTLT.
Yeah, RTLT, good. Then any other examples? LD modifier for cardiology, GC modifier for resident, AS modifier for aesthetic surgeon, and ramus intermediates, RI. Then left circuit LC, left main LM, right coronary RC. Then XU, XP, XE, and XS. These are the 4 X modifiers. Instead of 59, we'll be using XU separate unit, XP separate physician, XE is separate encounter, XS is separate structure. Instead of 59 for Medicare patients, based on the client specification, we use X modifier. So these are also falling under alpha modifiers. So individually, I will further sessions I will explain. Okay, this is just I'm giving the intro to understand the overview of the surgery and their concepts. So alpha modifiers, then numeric modifiers we can go. What are the numeric modifiers, guys?
22.
From 22, we can say 33, 50 bilateral modifier, 51.
62, 2 surgeons.
Yes, 52, 53 discontinued procedure, 58 staged procedure, 59 discontinued,
66.
66.
62, 80. No, etc.
76.
Yeah, 73, 74, 78, this and all. So then alphanumeric. I modifiers.
E1.
I lead modifiers, yes. E1, E2, E3, E4. Then toe
Yep.
modifiers, T1 to TA. We can say T1, T2, T3, T4, TA, this and all. Same finger modifiers, F1, F2, F3, F4, FA. So these are the finger modifiers. Any other? So, okay. These are the modifiers. Why we need to append the modifiers? So modifier is a T-digit, either alpha numeric or alphanumeric codes, which will be given to the CPT code, particular service, for providing the additional information of the service. And by applying this modifier, it will not change the exact definition of the CPT code. For example, I'm giving 44970 is a laparoscopic appendectomy code. So for laparoscopic appendectomy code, we have a code 44970. So while performing this laparoscopic appendectomy, if physician perform extensive adhesions from the abdominal cavity, so that means physician will spend more time than the required time. Just give me an example. The common general time to perform this laparoscopy appendectomy is 30 minutes, but physician spends 50 minutes. Why? Because while performing this laparoscopy appendectomy, the physician found extra growth of additional tissues in the abdominal cavity or peritoneal cavity. To remove those abnormal growth of tissue, physician spent more than 20 minutes than the required time. So hence, physician need to get more bill. Why? Because he spent 20 minutes more than the required time. So in these situations, along with 44970, you will be appending 22 modifier. This 22 modifier indicates increase the procedural service. So by applying this 22 modifiers, we are providing the additional information to the payer or insurance. We are giving the additional information, so physicians spend more time. So by giving these 22 modifiers, does it change in the definition of 44970 here?
The definition won't change.
Definition will not change, but the
Yeah.
additional information we are providing with the help of modifiers.
Yes.
Understood the concept of modifier? Any modifier?
Yeah, yes, sir.
Yeah. So not only 22, if you are giving any modifier, it won't change the exact definition of the CPT code. Instead of that, we are giving additional information to the payer or physician for billing purpose. So far clear everything, the concept, or do you want me to explain briefly? Anyone aware about surgery topics? Any topics? Anyone aware about the guidelines? Any topic from surgery from 1 to 6 series? Akhil, Adal, Anjali, Ananya, Gayatri.
No, sir.
Okay. Even ED people could have some idea, right? ED and people, they might have idea on bedside procedures. Hemavati, Hafaf, Imran, Jabin Sultana, Manohar, Megha, Neelesh, Padma, Pratiksha Naik, Rashid, Reshma. Please speak out. If we have good interaction in class, then we will be learning together good. If you get more questions, you will get more things. See, I'm not working with you in organization to command you. So I'm also being with you, and virtually I'm connecting with you. You no need to worry about others. So please be active in group.
Simple repair, complex repair.
Okay, simple repair and complex repair.
ATT includes excision.
Okay, who is Arun Sultana, right?
Yes, sir.
Okay, ATT includes excision. Okay, this is one kind of guideline. Any other?
Incision included in excision.
Includes. So what is the difference between incision and excision? Let me know. You said incision is included in excision. So first of all, what is the difference between incision and excision?
Excision means cut,
Incision
and
also
incision means
incision also cut, right?
With,
Excision means
for
cutting it
example,
and removing it.
Okay,
Incision
excision
means
means
only cutting.
surgical removal.
Yeah.
surgical removal.
Incision, they don't remove. They will make a cut to enter inside. For example, if you want to enter into a home, there are two ways. One, you can open the door and you can go. Second thing, you can break the door and you can go. So if you open the door to enter inside, that is called incision.
Yes.
Understand? Without affect the door. Here, skin will not affect. Excision means you break the door, because the door will, you lose your door. Here, excision, you lose your skin. Understand, guys, the concept?
Yes, yes, sir.
Incision and excision. So that is a major difference. So, okay, fine. We'll enter into the topic then. So there are more than 30,000 procedures involved in the CPT book, right? Depends on the patient condition, many type of surgeries and many types of services. So to perform a surgery, what physician need? First, we need a required skill of physician. The particular physician should have that required skills of the particular service. For example, if you take an ophthalmologist, can he able to perform cardiac surgeries?
No.
So he should have that particular skill. So, okay, particular skilled physician we got. So what physician need to perform a procedure exactly? For example, you are a physician, you are a cardiologist, you want to perform a cardiac procedures. What you need exactly initially?
We need to have a knowledge and we have to need equipments.
Equipments. Okay, done.
And first of all, we have to see the patient's condition.
Okay, give me any procedure name, whatever you know, in entire CPT book.
From cardiology.
No, your wish. Your wish. Any
Nephrectomy. Nephrectomy.
nephrectomy, right? Who is there?
Yes, sir.
Adal or Shravan?
Shravan.
Shravan, you mentioned nephrectomy. What is meant by nephrectomy, Shravan?
Surgical removal of stones from the kidney.
No, nephrectomy means removal of entire kidney. That is lithotripsy. Whatever you're talking, that is lithotripsy method. Nephrectomy means surgical removal of kidney. Either it may be partial kidney or total kidney.
Yes.
Surgical removal of kidney. So what are the possible ways to perform these procedures to the physician? How many possibilities? What are the possible ways? How he will reach to the kidney? Tell me.
Open or laparoscopy.
Fine, good. Open or laparoscopy. So open means what?
Large incision. Make a large incision at the side.
Yes.
Okay,
Incision.
so with the help of incision, he will enter into the kidney. Laparoscopy means
To approach the
laparoscopy.
kidney. Make a small incision at the side.
No.
Anyone? No, he's saying correct only. But
Laparoscopy is using holes.
yeah, so here also we need to require a very small incisions in MMs to insert the scope. So one side he can go with large incision, second side he will go with small incision by inserting the scopes. So these are the techniques, possible techniques to perform nephrectomy. If you take another procedures, there might be a different technique. So along with equipments, physician should know the techniques to perform a particular procedures. Right?
Yes, yes.
Yes.
If you take a biopsy of liver, we can take the biopsy of liver with the help of needle biopsy. Can we able to perform nephrectomy with the help of needle?
No, no, no.
No, sir.
Oh, yes. So each
It's
and
like
every procedure
removal.
will be done by physician based on the technique or approach. So what are the common techniques and approaches in the surgery? Now we'll discuss about common techniques. You understood, right? What is meant by technique?
Yes, yes.
Common techniques involved in surgery. So this session is we are recording. Later, if you want any recording session, will be provided for later joiners and people who are unable to join due to some office works. So common techniques involved in surgery. So as you said, one is open approach. Agreed. Second one is laparoscopic. Then third one is percutaneous. Then the fourth one is endoscopy. Then the fifth one is external approach. So these are the major techniques involved to perform any type of surgery by the particular physician. Open means, in simple words, how will you define open?
Incision. I mean,
Incision.
So even in percutaneous, even in percutaneous, they do incision. Even in laparoscopy, they do incision. Okay. Then how will you differentiate?
Opening the entire site.
entire side. Yes.
So the 3 centimeter incision should be there. Minimum incision size should be 3 centimeter. Remember this. For open approach, the incision size should be 3 centimeter. This is based on the general coding guidelines. Do not apply while coding practically. I will tell you how we will confirm the particular technique is open. So this word is just remember for interview purpose. 3 centimeter incision, and after incision, so in which part they do incision, guys? For example, patient is having a left tibial fracture or left ulnar fracture. The physician decided to perform open reduction of ulnar fracture. Okay. So now physician want to perform open reduction of ulnar fracture. Where is present ulnar? Ulnar radius, hand bones,
And one.
And
hand bones. So now where physician want to do incision? For example, if you want, yeah, ulnar side, left of hand, right hand, whatever it may be. To reach the bone level, what are the organs you need to cross?
skin, subcutaneous.
Yes, skin,
Layers.
subcutaneous tissue,
Fascia, muscle, bone.
fascia,
Fascia.
and muscle. These are the things you need to, these are the organs or structures we need to cross over. So they will do incision of skin. Then they will do dissection of the tissues. Dissection of tissue, fascia, and muscle until
It reach.
of the bone. Until visibility of bone. So here, after performing incision or dissection of tissues and fascia and muscle, can physician able to see the bone with the help of his eyes directly, or do he need any equipments to see the bone?
You can see that.
He can see directly, right? So open approach, not only based on the incision, the physician perform a procedure with his naked eye. Naked eye means we will not using any equipments to see. So he entered into the organ by incising the skin, and he cleared the way by dissection the tissue until visibility of bone. Then he can able to see the bone directly with the help of his naked eye without any help of surgical any equipments. So then he'll perform procedure. So these are the keywords to confirm the technique is falling under open. Understood the concept for open?
Yes.
Yes, yes, sir.
Everyone? Reshma? Reshma, are you there? Reshma from Nellore. Okay, fine. So this is this kind of technique falling under open approach. The physician will perform a procedure with the help of incision with the help of a naked eye. So while coming to laparoscopy, here physician will perform a small incisions in mm's, multiple incisions in abdominal level, actually in millimeters. mm's they'll perform in centimeters. So they will insert the ports, 3 to 4 ports, to perform a laparoscopy procedure. While coming to percutaneous, per means through, cutaneous means skin. Through the skin, this process will be done. For example, as I said, I will give a direct definition for percutaneous. Any procedure performed with the help of a needle or catheter.
FNA, fine needle aspiration, it will come, okay?
Yes. Any procedure performed with the help of needle and or catheters. Then those kind of approaches falling under percutaneous approach. Let me give an example. Physician want to take the biopsy sample of the liver. There is a 2 types of possible approaches. One, your physician make a patient to lie down in the prone position. He will cut the skin level, like posterior portion of the trunk, backside. Then he will open the posterior trunk. He can see directly liver. He can take a sample. This is one way. Second thing, with the help of imaging guidance, he can insert a needle. He will take the sample from the liver. These are the 2 approaches, right?
Yes, yes.
So with the help of needle, if they do needle biopsy, it will be falling under percutaneous. With the help of large incision, if they do liver biopsy, it will be falling under open approaches. While coming to catheter, so we have a blood vessels in our body, right? Arteries and veins.
Yeah.
Arteries carry oxygenated blood. Same way, veins carry deoxygenated blood. So there is a occlusion inside the blood vessels. There is obstruction in the blood flow. Then directly he cannot cut the artery to check the obstruction, right?
Yes, yes.
So such condition, he will make a small puncture to the artery. He will insert a catheter. He will insert a catheter to the arteries, like how we do electrical wiring in our home.
Yeah, yeah.
So same way they will do electrical wiring concept. They will apply electrical wiring concept in the blood vessels, arteries and veins. They do perform the procedure. But to insert a catheter, physician will do a small puncture. It is very less than the incision size, very, very less than the incision size. So orally, you need to remember, like any procedure performed with the help of needle and catheter, considered as a percutaneous. So stent placement of particular arteries, angioplasty procedures, thrombectomy, thrombolysis, liver biopsies, fine needle aspirations. So ESWL, these and many things. While coming to endoscopy, there we mentioned about laparoscopy. Endoscopy means here also they will insert a scopy to perform diagnostic and therapeutic services. But to insert a scopy, we do not require any incisions. Either it may be small or large. So with the help of natural orifices, they will insert the scopy. What are the natural orifices? Mouth, nose, anus. So if they do insert any endoscopy through anus, lower GI, colonoscopy procedures, upper GI through mouth and nose, EGD, esophagogastroduodenoscopies. Understood, guys?
Yes, sir.
So these scopes, they will insert inside the body through the natural orifices without any incision. Those procedures falling under endoscopies. So while coming to external approach, so till now we have discussed about 4 approaches. What are they? Open, laparoscopy, percutaneous, endoscopy. So in these 4, either physician did incision or physician used some surgical equipments, right?
Yes, yes.
So in EGD, sorry, in colonoscopy and EGD, there is no incision, but they use the scope. In open approach, they didn't use any surgical equipments, but they did an incision. In case of external approach, physician neither use incision nor surgical equipment. They don't use anything. Simply by applying the manual pressure on the target site, he will perform the procedure. For example, closed reduction fracture care. So to perform a closed reduction, do we need an incision?
No.
Do we need a surgical equipment?
No, sir.
So simply by applying the manual pressure, we will treat the condition. Second thing, ESWL. What is mean by ESWL? ESWL. Extracorporeal. We can say extra corporeal shock wave
Shock wave
lithotripsy.
lithotripsy.
So just type in Google ESWL, go to images, you will get a picture. So patient will be lying down in supine position in a bed. So below the bed, the physician will arrange a waves, electrical waves, which is directly impact to the kidney stones, and it may. What physician will do? ESWL means. Lithotripsy means what?
Surgical no.
Stones from the kidney.
Tripsy means
Yes, they will break down the stones. Break down the
break
stones.
down.
So here, physician will not doing any incision, and he's not using any surgical equipments which is directly impacting the skin, and even he's not touching his hand to the patient. He's sending the shock waves
Waves. Shock waves.
to break down the stones.
Stones.
So whatever the break down kidney stones will be coming through urine. So these are the common approaches, examples. Understood, guys? Everyone?
Yes, sir.
Okay, this is the general concept of surgery. So we didn't enter into the topics till now. So today I would like to mention about the definition of surgery and what is the concept of modifiers and what are the common techniques we can use. So moving sessions will be starting surgery completely from 1 to 6 series along with modifiers. Okay. Any doubts, guys, till now?
Okay, sir.
You want me to read?
No doubts, sir.
This will be sharing to you in group, and recordings also will be sharing. So people really want to learn surgery because previously we have given many batches. So 90% of the people who belongs to previous batches, they got settled into surgery. Even we help them to crack the interviews. So I cannot take the names. So people who really want to learn surgery, this is the correct platform. So definitely we'll be helping you. We also belongs to the same background from you guys came. So